Good afternoon, everyone. So I'll be talking about the trial Astrum-005, which was presented in ASCO this year. This is Serplulimab plus chemotherapy versus chemotherapy in extensive stage small cell lung cancer. So a little bit of background, as we all know, for the past 30 years, EP has been the standard first-line therapy in extensive stage small cell lung cancer. Immunotherapy has been tried, Atezo or Durva has been tried, and it is recommended. But they have been able to prolong the OS only by around 2 to 3 months. So there still exists a huge unmet medical need because of very small data for the action of immunotherapies in small cell lung cancer. And Serplulimab, the agent under investigation, has shown excellent anti-tumor activity with a safety profile which was manageable in the Astrum-010 trial. And the results which I am going to present are the interim analysis of the Astrum-005 study. So this is the study design. First-line therapy for extensive stage small cell lung cancer, stratified by PD-L1 status, brain mets, and age. So it was a 2:1 randomization between carbo-etopo plus Serplulimab versus carbo-etopo placebo, followed by maintenance until progression. The primary endpoint was overall survival, with the secondary endpoints of PFS, overall response rate, and duration of response, as well as safety and immunogenicity. So the sample size was considered as 567 patients were planned to be enrolled, and the pre-planned data analysis was one interim analysis and final analysis. So this is the interim analysis which was conducted when 226 deaths have occurred as per a statistical plan. So 585 patients were enrolled, 389 to the investigational arm, 196 to the placebo arm. And as of the data cutoff of October 22, 2021, the median follow-up duration was close to 1 year. This is the baseline characteristics, well matched. Close to 40% patients were more than 65 years, majority males with prior PD-L1 expression of TPS more than 1, only close to 15%, with a negative PD-L1, most of the patients close to 80%. 12% patients had baseline brain mets in the investigational arm. So this is the graph. Overall survival, median OS was 15 months in the investigational arm versus 10.9 months in the placebo arm, with an absolute benefit of close to 4.5 months, with a hazard ratio of 0.63, and with a 1 year survival rate of 60% versus 47%, more than close to 13% absolute benefit at 1 year. Coming on to the subgroup analysis, as we can see, the investigational drug Serplulimab benefits in most of the subgroups. The graph is on the left side, so definitely it favors as per the subgroup analysis. And this is the PFS data. The median PFS was 5.7 months versus 4.3 months, with a hazard ratio of 0.48, with a 1 year PFS rate of 23.8% versus 6%. So huge difference in the PFS rate as well. Coming on to the response rates, there was a 10% increment in the response rate, 70% versus 80% in the investigational arm. Duration of response in the patients who have either CR or PR, the duration of response with Serplulimab combination was 5.6 months as compared to placebo with chemo, which was 3.2 months. Coming on to the safety summary, well tolerated, basically no new adverse effects. The class effects of immunotherapy was there. Immunotherapy related side effects, grade 3 or more, were seen in 33% of the patients in the investigational arm. Led to treatment discontinuation in close to 5% patients, and 3 patients had death due to in the combination arm. And the most common immune adverse events were hypothyroidism or hypothyroidism rash, which we commonly see with other PD-1 inhibitors. No new spatial emergent effects. So coming on to the most common side effects, you can see myelosuppression, alopecia, nausea, decreased appetite, hyponatremia, and most of it was due to the chemo component. So as you can see in the graph, the bar chart, there was no side effect which was markedly different from the chemotherapy alone arm. So majority of the side effects could be attributed to the chemotherapy. So to conclude, Serplulimab plus chemotherapy has shown consistent benefits in the OS, PFS, as well as response rate and duration of response. There was a close to 4.5 month median OS benefit with a PFS benefit of 1.3 months. It had a manageable safety profile. No new safety signals were observed. And it has been granted the orphan drug designation by FDA. and the a new drug application has been submitted and it is under review by NMPA. Thank you.